All right, so tonight's webinar is the first in a two-part series. This is just an overview of the various programs the Social Security Administration has to offer. And we have with us here Lizna Odhwani from the Social Security Administration, and she'll be taking us through all of that.
All right. Well, thank you so much, Adrian and Newport News Public Libraries for having me tonight. And you pronounced my last name beautifully. I don't think anyone's pronounced it that good. My name is Lizna Odhwani, but you could just call me Liz. It's a lot easier. And today we're just going to go over the first part of just some basic tools and stuff we have available. The next week, we're going to be going over additional benefits we have because we have so many. So we had to break it out in two parts. But if you have any questions at the end, you can always use the chat box, or if time permits, you can unmute yourself, or whatever Adrian and the host would like to do at the end. So let's go ahead and get started. Social Security. So I've been with the administration. I'm the public affairs specialist for the Tidewater area, along with other cities as well in Western Tidewater as well. So East and West. So I've been with the agency 19 years now. So I've worked in a lot of different offices. I've worked in Houston, Texas, Dallas, Texas, Atlanta, Georgia, all over Richmond, many offices in Richmond. And then now I'm in public affairs. So I do education and outreach into the community. Different type of job because I'm not in depth with claims, but I can explain everything because I've done so many claims in my 19 years with the agency. So another thing we're going to talk about is updates during COVID. At this time, our field offices are not open for in-person contact. Now, we are making some exceptions with certain vulnerable populations, like the homeless population, and certain situations depending on a case-by-case basis. However, for the most part, everything is done over the phone. So if you need to call us, you can. Office hours are Monday to Friday, 9 to 4. We're going to be available again Monday to Friday, 9 to 4. And if you need to contact your local office, there's two ways you can do that. You can call 1-800-772-1213. Again, that's 1-800-772-1213. Or you can use the locator link that we have on our website. Now, our website is a very useful tool. So I recommend everybody to check out at least our homepage, socialsecurityssa.gov. So again, that's www.ssa.gov or www.socialsecurity.gov. And if you want to find out your local office, where it is, the phone number for that, you would just go to www.socialsecurity or ssa.gov/locator. You will put in your zip code and it will give you the number to the local office. So perfect. And it will give you the times, Monday to Friday, 9 to 4. If you need to mail something in, you can. However, if you call us and you need to schedule, like I said, a disability claim, a supplemental security income claim, a retirement, Medicare, spouse, survivor, whatever benefits you need to go ahead and file for, you can do that. We will make you a phone appointment, or you can even ask questions. So if you just have questions, we can help with that too. Now, the first, as you can see, it says Social Security, we're with you through life's journey. And isn't that true? As soon as you're born, you get a Social Security number assigned to you, right from the hospital. And if you need to stay in the hospital for more than 30 days because you're a NICU or low birth weight baby, we can help with those benefits as well. We can help with supplemental security income benefits at that time as well. So that helps the parents with Medicaid, right? It kind of helps with that. All the way up to when you pass away. Even after you pass away, Social Security will help your family members. So if you remember getting those green and white statements in the mail, we don't send them out anymore because of identity theft, right? So we want you to create your account. So that's Social Security or ssa.gov/my account. We try to make it easy. So create your account and you'll be able to see your statements, right? And even after you pass away, as you see, there's a section called family benefits. And in family benefits, benefits, you'll be able to see that you'll even get survivor. Family members can get survivor benefits. So if you're getting one of those crazy calls telling you your social security number is suspended, just know your number never gets suspended. Even after you pass away, it will not get suspended, because there will be family members that can draw off of your social security, your earnings. So just make sure to remember that. And if you get a crazy call, you can report those calls. I will get you the link on how to report it. And also, so yes, you could definitely report those calls, and make sure you do not, we will never ask you or threaten you to ask you for money. We will never ask you for gift cards. We're not going to do any of that. So just know that if you get a call like that, you can easily hang up on those calls. This slide is the agenda. Perfect. We're going to talk about the purpose of the social security number, the social security account, the statement. We're going to go into Medicare. I think we're doing more so. We're going to talk about retirement and disability today. Other benefits is going to be for next week. So other benefits, Medicare, applying for benefits, and we can go over frequently asked questions as well next week if you guys want, or you can just have your own questions. That'll work too. So the next slide talks about the social security number and card. And the next slide after that kind of explains what it is, right? What was the purpose of the social security card, right? Well, social security was passed 86 years ago. Last August was its 85th birthday, but we couldn't make it big because of COVID, right? But 86 years ago, Social Security was passed by Franklin D. Roosevelt. So it was passed a long time ago, and it was passed during the Depression. Okay, it was one of the New Deal's benefits, such as unemployment, right? Unemployment was passed at that time. TANF, or aid to families with dependent children, that was passed at that time. And so was Social Security. And it was supposed to help people get out of the Depression. Okay, so that was one of those reasons why it was passed. So some history there for you. Now it was passed for that, but remember, so there were a lot of people facing poverty, right? So this was the reason for that. So that's when they created the Social Security Act. Okay. And so then they created the Social Security number. And the purpose of the number, it's a 9-digit Social Security number to record a person's wages so that they can get a pension. A lot of times at that time, there was poverty. There wasn't a retirement pension or anything guaranteed for the average worker. So what they would do is they came up with this so that everybody can at least, have some sort of retirement or some sort of pension. And then it opened up to other benefits like disability benefits, spousal benefits, right? Because let's say you have one breadwinner in the household and then you have one check coming in for their retirement. So that's not going to help because you have two people in the household. Maybe one didn't work for earnings, but they probably worked. So, that didn't help. So it was going back to poverty, right? So that's when they opened it up for spousal benefits and things like that. But the purpose was to record your earnings. And that's why every year you used to see your statements come in for checks and balances, right? You wanted to make sure that those earnings on those statements were correct, right? Because it is your benefits in the future are based on what you worked and paid into FICA, the Federal Insurance Contributions Act, or Social Security tax. So when you start a new job, your employer usually requires you to show your Social Security card, or actually ask for one for wage reporting purposes, because they're responsible for letting us know what you've made. That's why we get those green and white statements out to you to make sure that that is correct, because that's what your benefits are made up of. So the next slide is going to talk a little bit more about FICA. FICA stands for Federal Insurance Contributions Act, and it's exactly what that is. It is a federal tax. It is a federal insurance. It's not a state thing. So, you can go to any state and you work for a job, they're going to have Social Security, then it's going to come out, right? Very different than your state pensions, right? So federal insurance, and the more you put in, the more you get. It's an insurance. So the more you work, the more you eventually receive. That's why a person with a higher earnings history is going to receive more benefits versus someone who hasn't worked that much, right? It's an insurance. It stands for Federal Insurance Contributions Act. It is a payroll tax deducted from a worker's paycheck. It's matched by the employer. So every check that you work, 7.65% is what's deducted. Okay, 7.65%. Your employer matches it. So you actually get a little bit over 15% when it's time for you to retire. Okay, that's your contribution. Total FICA tax 15.3 because of that 7.65 times 3, right? 6.2% times 2, sorry. 6.2% of the 7.65 that you're actually being taxed is your money. That's going to be your benefit. So whatever your employer gives you and then whatever you get. So let's say 12.4%. 12.4% is what you're getting back. Okay, because you're going to have 7.65% come out, your employer is going to match it. So that's your benefit. So when you see that green and white statement and you see benefits, that's what you're getting back. 1.45, the remainder of the 7.65 is your Medicare. That's your Medicare Part A for Apple. That's going to cover 80% of your hospital bills if you're in the hospital for more than 3 days. That's a lifesaver, because if you actually did not work and pay into Social Security and you have to pay for Medicare Part A out of pocket, you're talking $400 to $500 a month. So this is great because you've already worked it, you've earned it, it came out of your Social Security, it came out of your tax. So this will help you with that. So that's why you don't have to pay a premium for Part A when you take it, because you've already paid into it with 10 years of work, okay? And of course, the FICA taxes help you with all sorts of the benefits that we're going to talk about. Now, the next slide talks about how to get a replacement Social Security card. Now, I will say the My Social Security account has always been in place, and it has always, in the last few years, it's been allowing people to, get their replacement Social Security card online. And that's great, because if you have an employer and you're looking for a job, instead of waiting in the office, you get a little receipt from the office, and then you have to go and you'll wait 2 weeks until the card comes in the mail. This is great, because as soon as you log in and you create your account and you request your Social Security card, because you lost it, it'll actually send you an email with that same receipt. And you can go ahead and send that to your employer or your new employer, and you'll get the card in the mail in 2 weeks. It always came from headquarters, right? You never walked home with the Social Security card if you went to the office. It always was mailed out to you. So it's still being mailed out from the same place, but you don't have to wait in line. All you need is your driver's license or your state ID. In order for you to get your Social Security card replaced online using your My Social Security account, again, that's socialsecurity.gov/my account. Or if you go to our homepage, you'll see the link for it. You need is you need to be 18 years old. So you have to be over the age of 18, a US citizen, and just for a replacement card. Okay, so if you're not able to do it, you can't create your account, you can't get your replacement card, you can mail it in. You can mail in the application. That's going to be under socialsecurity.gov/forms, which you'll see when you log into our homepage. You'll scroll all the way to the bottom. You'll see icons for publication, forms, all sorts of stuff. You can just put in forms. And then the very first form you'll see is the application for the Social Security card, because again, that's a very popular thing, right? And then whatever proofs you need, you would mail that in. If you're just looking for a replacement card, you're over the age of 18, a medical record will work, a letter from a doctor will work with your name and birth date and stuff. So, and you don't have to mail in your driver's license. You can use a medical record too. So the next slide is talking about protecting you from fraud and abuse. So that's the protecting your number and your card. Now, as I stated, I'm sure identity theft is the #1 crime in the United States, unfortunately. This is why we stopped sending out those statements. You can view those if you create your account. You can, again, get your Social Security card. And another thing was your Medicare card. If you remember, the Medicare card used to be a Social Security number. Now it's a new alphanumeric number. That changed back in 2018, 2019, not very long ago, so that you're not walking around with your Social Security card, especially seniors' Social Security number. So Social Security protects your Social Security number, and we keep our records confidential. Again, even for this webinar, I'm using my personal cell phone. I'm not allowed to host it. It's being, the Newport News Library is hosting it, and they're sharing their screen and advancing it. We are very secure with your information, trust me. We have to be very careful about sharing your number, even when we're asked for it. So you want to be careful about sharing your number. You want to keep your card and other documents in a very safe place. And again, like I said, with the Medicare card, it's now changed into an alphanumeric number because we don't want you walking around with it. Okay. The next slide is talking about fraud, and scams. Now, these numbers have changed drastically for 2020, but this is 2019. So 3.2 million fraud, identity theft, and other reports to the Federal Trade Commission in 2019. These are just people that reported it. And 3.2 million is still a lot of people. Now it's saying 1.1 in 10 people lost money in imposter scams totaling $667 million in 2019. We're going to change that. In 2020, 1 in 5 people have lost money. Okay, we're still getting the data on that, but 1 in 5 people have lost money. People have been sitting at home. They've been getting these calls. They've been listening, they're finally like, okay, well, what are you talking about? And then they're actually scared. I mean, the pandemic caused a lot of different emotions to come, especially loneliness. So if somebody's calling and saying that to you, you might believe it. You might have anxiety. So these things do happen. Unfortunately, now it's 1 in 5. So that has changed. So we want you to protect your identifying number. And of course, if you have a PIN number, because identity theft is one of the fastest growing crimes in America, just like I said. So you want to protect your personal your PIN number if you have it. Thieves may have access to your existing PINs. Do not write down your passwords. And if you do, don't keep them in your purse, wallet, desk drawer. Memorize your social security number. Do not write it down. Refrain from using your mother's maiden name and avoid using the last 4 digits of your social security number. If you do need to report a crime, we do suggest you contact the Federal Trade Commission. You would just go to www.ftc.gov and you'll be able to go ahead and do a report if you feel like you have been a victim of identity theft. The next slide talks about be cautious, of course, of suspicious calls. So Social Security employees, we do contact citizens. Absolutely. If you're calling us and you need an appointment, we're going to call you to give you your appointment, right? Or call you for your appointment. If you call us with a question and we need to do additional research, we're going to call you back. Absolutely. However, we're not just going to randomly call you. We're going to call people who we have ongoing business with. So randomly, if you get a call or an email saying, your number is suspended, you owe us money, it doesn't make any sense. Go ahead and you can report that. So of course, we will call you if you've called us as customer service, but we usually will mail you a letter. Employees will never threaten you with arrest or other legal action if you don't provide the requested information. Those calls are of course fraudulent, and the way to report it is that link https://OIG for Office of Inspector General .ssa.gov/report. And again, you will have access to these links on the follow-up email that Adrian will send. So the next slide is talking about my Social Security account. And the slide after that is the actual account. How do you log in? So that's going to be SSA or socialsecurity.gov/my account. Again, I have an account and I'm nowhere close to retirement. So I definitely suggest that if you're working, you're over the age of 18, you want to track your earnings because those statements don't come anymore because of identity theft. So I'm hoping all of this makes sense. And if you need your Social Security card replaced, it's great to have an account, right? You just log in with your driver's license or your ID, and you'll be able to get your Social Security card in the mail in 2 weeks, right? And you'll get that nice email letting you know it'll be there in 2 weeks. The next slide is just letting you know how to step-by-step instructions. So that's going to be the socialsecurity.gov/my account. You would go to sign in or create an account. And again, you can have access to the My Account through the home page too. So even if you go to ssa.gov or socialsecurity.gov, you'll see a little finger pointing hand there, and you can definitely click on that. It's going to ask you some identifying questions to make sure it's you. So that's important to understand because we want to make sure it's you. Our system has not been hacked and we don't want it to be hacked. So I always tell people you want to create your account because if you haven't, somebody else might have, in your name. So that's why you want to make sure that you do have an account set up for yourself because it is very secure. Then you'll come up with a username and password, just like online banking or an email. And every time you log in, every single time you log in, you will get a security code, which you'll put in the system. So that way, or put in with the web page, so that way they know it's you. So either it'll be a text or email, depending on whatever you chose. Now, the next slide is talking about additional security. So of course, each time you log in, you're going to have to put in your username and password. You'll get the security code. If you want additional security, you can get it. I would say first create your account and then go ahead and ask for the extra security. So the next slide talks about the services we offer with the My Social Security account. As I mentioned, if you don't receive benefits, you can still get your replacement Social Security card over the age of 18, a US citizen, and just a replacement card. If you're trying to do a name change, or is it for a child or something like that, or a citizenship change or something like that, you do have to submit additional documents. So it's not as straightforward as just a replacement card. So that's why you would have to go through the mail in the office. But prior to that, if it's just a replacement card, you can do that. If you filed an application, let's say you did it over the phone or you did it online and you don't want to wait on hold with the local office, you can get the status of your application, or you could file an appeal and get the status of your appeal if you got denied with something. You could do all of that online too. If you need proof that you're not on benefits yet, because you're filing for other programs, you can get a proof of income letter that you're not on Social Security. And even if you are on Social Security, you can get a proof of income letter stating you are and the amount that you're receiving if you're filing for other benefits. Another thing, I don't think I have it here, but if you are on benefits and you need to update or check your address, your phone number, your direct deposit, get your 1099, your proof of income letter, get your Medicare card replaced. Like I said, even get your Social Security card replaced. You can do all of that too. So that's great. But if you're not on benefits, you can still see your green and white statements in the mail, and you could play with our 11 different calculators. So it's really good for prepping, if you're trying to prepare for benefit, number one, to check your earnings every year. Because honestly, if I retire 30 years from now, I'm not going to remember what I made in 2021, right? I don't remember what I made in 2020. So that's why as soon as I see my W-2, I log into my account, make sure everything is matching, and I'm good to go. I know my benefits will be right. If you do see a discrepancy, you can call and you can mail in your W-2 or your tax forms, whatever your tax returns are. So if you're self-employed, and we will correct that for you. None of those services are ceased. Everything is still good to go. Everything is just being done by mail and phone and online. That's all. So the next slide is talking about your statement. So the slide after this is the statement I keep talking about, the popular green and white statement that I don't know if many people even remember this or know this, but we do. We used to send you out these statements every year. It was about 2 pages, and it had your benefit amount and your work history, and it had all of that there. So the next slide is going to hone into your benefits. So as you can see, we offer a variety of benefits: retirement, disability, which we're going to talk about today, and then family benefits, survivor benefits, and Medicare is what we're talking about next time. But as you can see, this is all based on that 7.65% that comes out of your check. Like I said, 6.2% is what is your benefits, and then your employer matches it. So you're actually getting 12.4% back of whatever you've grossed every check. So it is, so that's how they base your numbers, which I'm going to go into more with retirement on how it's calculated. And then the next slide is what your homework is, right? To make sure that for the year that you've worked, everything does match, okay? And again, if you have a W-2 or a tax return, we will be able to correct it for you. All you have to do is mail it into your local office, and we'll be able to update that for you. The next slide talks about retirement benefits. So the slide after this is just a quick reminder that Social Security was never, ever meant to be 100% of your retirement. Unfortunately, for a lot of people who have not done their homework or haven't been able to save or have any additional pensions, it is 100%, but it's never meant to be 100%. Social Security was never meant to be the only source of income. So we definitely want you, and it's not based on need. Social Security is a pension. It's based on what you worked. So you can have other income, other savings, investments, pensions. Your spouse can even draw Social Security. It's not based on need. It's based on what you worked, okay? So the next slide is talking about how do you qualify for Social Security, right? Like, how do you even get this? Well, you have to work at least 10 years. So every year you work, you earn 4 credits. So as long as you work 10 years, you will get something. You might not get a whole lot, but you will get something. Okay. So by earning credits, which is the quarters. So every year, January, February, March, you earn a credit. So January, February, March, April, May, June, July, August, September, October, November, December. Every quarter you can earn one credit as long as you've made a minimum amount. And in 2021, in 3 months, as long as you've made $1,470, you've earned a credit. Very easy. So every 3 months, which you probably have if you're working, you probably have bills and you need to make that much or more. So as long as you've made $1,470 gross before taxes, every 3 months, you have one credit. So then you have 4 credits for the year. Okay. So if you take that 1,470 and times it by 4 to give you an annual average, as long as you've made $5,880 in 2021 and you haven't worked 10 years yet, like this is maybe year 5, you have your 4 credits. Okay. So that's how you earn your 4 credits. So you just need to work 10 years, really. They don't even have to be consistent. You could have gone back to school, raised the family, as long as you work 10 years, you'll be able to get it. And whatever the minimum is for that certain year, which most people meet, if they're working full time, then they can go ahead and they know that they have enough. They're insured, right? They're insured. You have to be 62 years old in order to start drawing your retirement. You can get disability, but that's a different calculation. But for retirement, you have to be at least 62 to start drawing it. The next slide talks about, so how do we figure out your benefits, right? We talked about 7.65%, and then your employer is matching it, 10 years of work. It's a lot. So what we do, the reason we want you to check how much you've worked and put into Social Security, like I said, more so checks and balances, because it is based on what you've worked, right? And that percentage, right? So we want to make sure what you've made is correct for that year. So for example, what we do is we take the highest 35 years of the last 40 years of work. So we drop the lowest 5 to help your average, okay? But let's say you've only worked 10 years. Yes, you'll get something, but you'll have 25 zeros added up with it. So if you have 25 zeros, that's going to drop your average, right? So for any years you haven't worked and you don't have 35 years, you're going to have some zeros. So the more a person works, the more they've put into Social Security, the higher their benefits will be. The less a person works, the less they've put into Social Security, the less their benefits will be. But you need at least 10 years of work. But when we're doing the math, we're looking at the highest 35 years of the last 40 years of work. Another reason, like I said, you want to make sure your amounts are correct is because of inflation, right? The value of the dollar has gotten less. You need more money to live. Back in, let's say, the 1970s, a house is not going to cost what it's costing today, right? A car doesn't cost what it's costing today. I noticed something in the 1950s or 60s, a McDonald's menu, you could get an entire meal for like $1. Now you have $1 menu. You can get one thing for like $1. So the value of the dollar has gotten less. You need more money to live. We look at inflation. So what you've made in 1990, let's say you've made $50,000 in 1990. Well, today you need more money than $50,000. That $50 is actually, we have to go ahead and look at it and what its value is today, right? So obviously you're going to need more money. So when we're figuring out your calculation, 2021, we're not going to count it as $50,000. We're going to count it as $80,000 or something like that. So we can make sure we pay you a livable pension. Okay. So again, because you need more money to live, right? So we do look at inflation. All right. And that's why it's important that you track your earnings, because you want to make sure you're going to get paid the right amount when you want to start receiving it. Right. So the next slide says if you have a gap in your earnings, your retirement benefits, like I mentioned, is based on your highest 35 years of indexed earnings. If you do not have 35 years of earnings, we calculate your benefit using a 0 for each year without earnings. So you want to be proactive, not reactive. That's one of my favorite slogans. It's important to review your earnings for accuracy every year. So the next slide talks about, so I've been working in a lot of different offices. I've taken a lot of claims. Doesn't matter where I'm at. If I'm in Texas, if I'm in Georgia, if I'm in Virginia, I always get asked the same question. When should I take my benefit? Right? What's the best way to maximize my benefits? Makes sense to me. You worked all your life. You want to make sure you get the most out of it. So you have a range here. You can start as early as 62, that's early retirement, or you could wait until 70, which is delayed retirement. Most people confuse delayed retirement with full retirement age. That is not true. Full retirement age used to be 65, right? This is before Reagan's time. So full retirement age has been changed about 40 years ago. So that's not recent. It's a long time ago. It used to be 65, right? 65 was the it age. You filed for your retirement, you filed for your Medicare, and you were done, right? That was a beautiful thing. Now, however, they changed it, not by much. Again, Reagan changed it about 40 years ago. So if you were born after 1954, or if you were born from 1948 to 54, your full retirement age is actually 66. And then if you were born after 1954, it's 66 in 2 years, 4 years, 6 years, 10, 66 in 2 months, 4 months, 6 months, 10 months. And then if you were born after 1967, your full retirement age after 1960, sorry, if you were born after 1960, your full retirement age is 67, right? So it hasn't changed by much, right? Maybe a year, couple of years is what your full retirement age is. But for every year you wait past full retirement age, you're looking at an 8% increase. There is no benefit in waiting past 70 because that's the maximum you can get. That's delayed retirement credit. So any year you wait, or any month you wait after your full retirement age, that's a delayed retirement credit. That is not full retirement age. Now, when we're looking at your average, the highest 35 years of the last 40 years and all of that, what we're looking at is what you would get at your full retirement age. So in this example, your full retirement age is 66. This person was born in 1954. Their full retirement age is 66 years old. I'm just keeping it simple. And they're going to get $1,000 a month. Easy enough, they're going to get $1,000. Now, every year they wait, if they don't want to take it at full retirement age, they're going to get an 8% increase. So as you can see, the next year they're going to get $1,080. If they're not working or anything, they just keep it the way it is. In 68, they're going to get $1,160. At 69, they'll get $1,240. And at 70, they'll get $1,320. So that's the maximum, right? 66 to 70 is 4 years. 4 times 8 is 32. There you see 1,320, right? Now, if you want to work and you want to take the benefit at full retirement age, you can work and make as much as you like as well. Okay, this is if you just left it alone. But if you want to work, you can. And of course, your average is going to continue to go up because you're still working and paying into your Social Security. So obviously, we're going to recomp it. So if it's going to be a higher year than what you've made in the past, we're going to replace one of those lower years with this new year. And you might receive a nice little letter stating, hey, we owe you a little bit of back payment. And your family benefits have gotten up too because your primary amount has gotten up. Your average has gotten up. So again, for every year you wait, you get an 8% increase. Now, if you take it before your full retirement age, as early as 62, you'll have a reduction, right? Now, there's a 25% reduction. That's the maximum we'll reduce it. So at 62, instead of getting $1,000, you'll get $750, right? And then for every month you wait, it goes up a little bit. So you're looking for 750 to 800 to whatever the case may be. So now the only other thing is if you take it before full retirement age, not only do you have a reduction, but you can't work and make as much as you like. So at 66, you could work, take the 1,000 and continue on. However, if you take it before, there is a limit to how much you can make. So there is some work involved. Now, the other question I get is, like I said, the main question I get is, when should I take my check? My answer is how long you plan on living, right? And I'll explain why. Between the ages of 66 and 70, right? If you don't take it at 66 and you take it at 70, you're going to get an extra $320. But what are you giving up? You're giving up $48,000 between those 4 years, 66 and 70. Every month you would have gotten $1,000. So 12 months in a year for 4 years is 48. So you'd be giving up $48,000. And how long do you have to live to break even, right? So that's when you hear break even. So you're giving up $48,000, so you can get an extra $320. So how long do you have to live to get your $48,000 back that you gave up on the front end? On average, you're looking at 13 to 14 years. So you'll have to live till you're 83 or 84 years old. So that's why I say, you tell me how long you plan on living, I'll tell you when to take your check, right? So there's a lot of factors involved. The next slide is letting you know about working while receiving benefits. So as I mentioned, if you take it before full retirement age, you cannot make as much as you like. There is a limit. That limit changes every year. So it goes up a little bit every year. Cost of living, you need more money. So 2021, if you're wanting to take it in a calendar year between January through December, your yearly amount, if you're working, you cannot earn more than $18,960 for an entire year. So if you're making $20,000, we're going to subtract $18,960 from that. Whatever's left over, we're going to divide it by half. So for every $2 that you make over, we withhold $1 from your check. So if you get a letter stating you're overpaid, it's because you made more than the allowable limit if you were working. Okay, so again, if you made $20,000, we're going to subtract $18,960. Whatever's left, we're going to divide it by half, and that's what you owe us. So you don't owe us dollar for dollar. It's for every $2 you make over, we withhold $1. Now, let's say you're going to retire at 62, but your birthday is until June, and you've already made $18,960. You've already made that between January and May. Right? So that's okay. We're not going to count that against you because you weren't drawing a check yet. It only counts when you start drawing a check. Okay. So for example, what we do is we take that $18,960, we divide it by 12. That gives you that $1,580 figure, $1,580 before taxes, before anything is cut. That is what you could make the rest of the year once you start drawing benefits. So from June through December, if you want to work, you can, but you have to stay under the monthly rate. There's no 2-for-1 with that. You just have to stay under the monthly rate. So that's that $1,580 a month. And then again, the following year, you just have to stay under the yearly rate. So then, because that's a full calendar year, the following year. But if you take it in the middle of the year, whatever you've made prior to that, we don't count against you. Whatever you make after you start drawing benefits, you're under the monthly test. Now, a lot of people, they'll wait until the year they turn full retirement age to start working again or take their benefit. Why? Because you could make more. Same person comes in, birthday's in June, turning 66, their full retirement age. They want to take their benefits starting January. Why? Because they might get a little bit of a difference, right? If you take it in January, it might be reduced a little bit, not a whole lot, not like years worth, but you can make more, right? Or if they took it in the past and now all of a sudden they didn't work that much, but now they want to go back to work, they can actually do that the year they've turned full retirement age because you get a little bit of a break. So between January and May, for the person who wants to take it in January, they could make $50,520, right, in those first 5 months. And starting June, the month they've turned 66, they're free to make whatever they want. And for every $3 they've made over prior to turning their full retirement age, we'll withhold $1. So you definitely get a break the year you turn full retirement age. After you've hit full retirement age, after that June that you've turned 66, you're free to make whatever you want. You're not answerable to us. You're just answerable to IRS, really. So for us, you can make whatever you want. There's no issue. Once you hit full retirement age, you start your benefits, you're free to make whatever you want. The next slide is talking about our different calculators. So as I mentioned, we have the life expectancy calculator, spouses benefits for spouses, because again, everything's housed online. You can see your family benefits. So if a spouse is not waiting until full retirement age to take it, and they're taking it before their full retirement age, how much can they get off of your record, right? So that gives you a better idea. The thing about the statements is that it only shows you 62, full retirement age, and 70. That's all it shows you, those 3 figures, when it comes to your own retirement. But let's say, like last year, a lot of people lost their jobs due to the pandemic. They wanted to work and wait until retirement, but they were 62, they lost their jobs. They could have taken retirement. So what if they were 63 in 4 months? That's kind of random. So you can actually put that into the calculator because everything's already housed online, and you can actually see how much you could get based on what you've worked and put into, and when you're planning on taking it. So that's a little bit better. The next slide talks about the calculators. So as I said, you can access this through your My Social Security account. compare individualized retirement benefit estimates at 62, full, or 70. But now you have the feature, as I mentioned, you can be very specific, 64 in 4 months. You could use a future date like June of 2025, and you just put in what you plan on making until then, and it'll give you an idea. So that's the link for that as well. The next slide is talking about disability. So we did a little overview on retirement. Now we're going to go into disability. The next slide after this talks about the benefits. What do we have? What is it? So Social Security disability insurance. So when you see your green and white statement, you'll see a section for disability too. That's your disability insurance, what you've worked and what you've paid into. So Social Security disability insurance provides income to people who are no longer able to work because of a disability condition. And it does not pay partial or temporary payments. It has to be in a situation where the disability is expecting to last a year or more. So definitely is long-term or result in death. So it's pretty long-term. It's for people who cannot perform substantial gainful activity or substantial work, meaning that there's a limit to how much they can make. So unlike retirement, where you could make about $20,000, right? $18,960. Social Security, you can only make, if you're on filing for regular disability and you're working, you can only make $1,310 a month with a job. So if you have a job, remember I said $1,580 a month for retirement, we're looking at $1,310 if you're trying to file for Social Security disability. Again, as I mentioned, they have to have a medical condition expected to last 12 months, resulting in death or result in death. If they're younger than full retirement age and earn less, then they have to be younger than full retirement age, and they cannot be making that $1,580. They're filing for disability, so they have to be under $1,310. And again, these are 2021 figures. And again, they have to have recent work. So we're looking at the last 10 years of work when we're calculating your disability benefit. Again, you would go to ssa.gov/disability for more information, but you will receive that follow-up. Now, another thing, most people think that, when you file for benefits, you get denied the first time. That's what most people think, right? Well, you can file, you'll get denied, you'll have to file an appeal. Not true. Sorry. 50% of cases do get denied. Absolutely. But the reason 50% of cases get denied the first time is because of lack of information. People assume we already have it in the computer. We don't. If you've never filed for benefits before, we need everything from you. So you'll also see on your follow-up email about disability information too. But it's a 5-step. What they're looking at when they're making a decision is 5 steps. So number one, if they're working. If you're working, how much are you making? Are you making more than $1,310 a month or not? So if you're working, your wage amount, right? It has to be $1,310 or less, $1,310 a month or less. Again, we're jumping into disability, so that's a different amount. Number 2 is your medical condition severe. Again, it has to last for at least a year or result in death. We're not paying short term. Does your impairment meet or equal a listing? Well, for that, we have a special book. It's called the Blue Book. As you can see on the bottom of the slide, you'll see a link. That link is, if you're trying to fall asleep at night, I'm your girl, because that'll put you to sleep. It is all of our conditions that they look at. This is for children, adults, mental and physical. So again, you got lots of medical stuff there. So it doesn't have to equal a listing. It could even meet a listing. So does your impairment meet or equal a listing? When I'm taking disability claims, the most question I get is this enough? Did I put enough information in? I always tell people, list it all. Now is your time. Do not be shy. Do not be embarrassed. You have back issues. You have high blood pressure. You have diabetes, anxiety, depression, whatever you got going on, list it. Okay. It might not meet a listing, but it might equal one. Okay. So definitely go ahead and list everything at that time. Can you do the work you did before? That's why we look at your previous work history. And also, can you do any other work? We ask about education, right? What's the highest level of school you've completed? Have you done vocational rehab? Things like that. So there is a method to the madness, okay? And this is why they ask those questions. Now, the next slide talks about how work affects your disability benefits. Social Security has special rules to help people with disabilities keep their benefits. So for example, and Medicare. So we do allow you to test your work. For example, work expenses, vocation. So we have a program called Ticket to Work. Ticket to Work is great for all of our beneficiaries. If you're trying to go back to work, get vocational rehab, all you have to do is you can go through the Red Book, which you'll see ssa.gov/redbook. And again, you will get a copy of this PowerPoint. But as you'll see, this will give you, we want you to become self-sufficient. So this is free vocational rehab. The Ticket to Work program is free vocational rehab for anybody who just wants to get free help. That's it. Now, if you're working, let's say with a disability and you're paying a copay, right? Or you need transportation, you can't drive, so you're hiring an Uber or a taxi or whoever you're hiring, and you have to pay them. We will not count those expenses against you, but you do have to keep a paper trail. So keep receipts and make sure you turn those in. But let's say you're making $1,500 a month. Well, that puts you over, right? You're at $1,310. That's over that $1,310 limit. But let's say $300 of the $1,500 is for your transportation costs for the month. So that means we're not going to count $1,500. We're going to count $1,200. But you want to make sure you keep your receipts. Okay, copay, service animal, any extra help you're receiving at the job, an extra person, we will look at all of that. So if you're paying anything out of pocket, then we do deduct those payments. Now, the next slide is talking about Supplemental Security Income, which is another program we offer, right? Supplemental Security Income is based on need. It is not based on work. So you will not see a section on your green and white statement on Supplemental Security Income, okay? It is solely based on need. Even children can get it. When I mentioned earlier, we're with you from the beginning. If you're in the hospital for more than 30 days, even if you're a NICU baby at low birth weight, if you're expected to be there for more than 30 days, you can file for Supplemental Security Income. At that point, we're not looking at parents' income because parents are not going to be there. They're not living there with you. But if you're under the age of 18 and you live with your parents, we do count your parents' income. If you're over the age of 18, we don't look at parents' income. But if you're married, we have to look at spouse's income. If you have children, you have other income coming in, like child support or any other benefits, we will look at all of that. But Supplemental Security Income is based on need. A child can get it if they're living with parents that are, we do a financial screening that qualify, or if you're over the age of 18 or 18, we only look at your income. You do have to have a disability unless you're 65. At 65, I think most people have some sort of ailment. But before 65, if you're filing, you do have to have some sort of condition. If you file after 65, we just look at your financial screening. So Supplemental Security Income, or SSI, is a federal program that provides monthly payments to people who have limited income and resources. This is tax-free money because it is based on need. It's for people who are 65 or older, as well as those of any age, even children, who are blind or have some sort of condition, but it is based on need and parents' income, similar to food stamps, similar to TANF, AFDC, aid to families with dependent children, similar to Section 8. It's very similar in the financial screening process. So the next slide is a side-by-side comparison of the two different programs. So we have Social Security disability insurance versus Supplemental Security Income. Adrian, the next slide. Perfect. Thank you. Thank you. So Social Security disability insurance is what you worked and paid into, what I mentioned earlier. So it's payments that come from the Social Security Trust Fund and are based on a person's earnings. It's an insurance that workers earn by paying Social Security taxes on their wages, the 7.65%. It pays benefits to disabled individuals who are unable to work regardless of income or resources. So a very popular question I was getting during the pandemic and the unemployment was, is my unemployment going to affect my Social Security disability insurance? No, it's not, because if you're still looking for part-time work, you could still get unemployment, right? And you can work part-time while you're on Social Security, right? But if it doesn't matter how much your unemployment is, it will not affect your regular Social Security. Okay, because Social Security is not based on need. We just have to see if you're working. If so, how much are you making? No other income messes you up. Not veterans, not any IRAs, not your bank account, nothing like that. And benefits for workers and for adults disabled since childhood. Now, Supplemental Security Income are payments that come from the general treasury fund, not from the Social Security Trust Fund. Supplemental Security Income or SSI payments are not based on a person's earnings. It's based on need. It's not based on work, right? Even a child can get it. It's a needs-based public assistance program that does not require a person to have a work history like ever. It pays disabled individuals who are unable to work and have limited income and resources. So unemployment does affect supplemental security income. Household income affects that. Benefits for children and adults in financial need. They must have limited income and limited resources. So SSI truly is a financial screening. Social Security disability is not only for you, it could also be with that family benefit. It could be for a spouse. It could be for a disabled adult child. It could be for minor children. So Social Security is definitely an insurance, not only for you, but also for your family too. And we're going to go more into that next time. Okay. The next slide talks about if you disagree with a medical decision. Let's say you get denied for benefits. You can file an appeal. You have 60 days to file an appeal. I highly recommend you do that. And if you have a My Social Security account, you could submit it right online. You don't have to wait for paperwork or mail things in. If you have a My Social Security account, it's very easy to do. The first step of the appeal, you have to do it within 60 days of when you got denied. And that's why you want to keep checking your account, make sure you have the status there, or make sure you look for it in the mail. You have to do it within 60 days. Okay, the first appeal is called a reconsideration, and that's exactly what it is. They're going to reconsider the case. Somebody else will get it at the state agency, not the same person, and they're going to look at the facts of the case again. If you get approved, though, you might get back payment. So remember, from the first time you filed, if you do an appeal and they go back and approve you, you're going to get some back payment from that time. However, if you don't do an appeal, you're starting from scratch, there's no back payment for you. That's it. You're just going to get it from when you refiled, right? So you want to make sure you do it within those 60 days. Now, if you get denied again, you can go in front of a judge, and that's the hearing. So you'll see hearing before administrative law judge, very straightforward, ALJ. That's when you go in front of a judge and you plead your case. If your judge approves it, then again, we can go back from when you last filed, your initial filing. However, if you don't do an appeal, you're just starting from those 2 or 3 months before. That's the only money you're going to get because you never did it. And it could have gone to the same person. It could have been denied again. So a lot of people get denied because they didn't file an appeal. So it didn't have a chance for anybody else to review it. The third way to appeal it, the third step is appeals council review. And then the fourth is actually a federal court review. So that's more information on appeals. You could even do ssa.gov/appeals and you'll be able to get this information. And that is it. So these were your basic benefits. The next time, like I said, we're going to talk more about family benefits, spousal benefits, survivor, children, disabled adult children, and Medicare as well. But this is a good little overview of part 1. So if you have any questions, feel free to ask. Thank you so much for having me. Thanks.
Well, thank you very much, Liz. But yeah, any questions anyone has, you can take those in the chat. Part 2 will be next week, Thursday, the 27th. It'll be at the same time at 6 o'clock. If you're not already registered for it, just remember it has a separate registration. So it'll actually be a different Zoom link from this one. And both parts will be uploaded to the Newport News Public Library's YouTube channel, just in case you'd like to, if you missed anything or you just like to review it again.
Now's your time because then you're stuck on hold. So if you have any questions, and I'm sure everybody on here has a My Social Security account, so you're probably looking into your account. If I didn't put you to sleep yet, you're looking at your account.
I actually signed up for one myself just now.
Oh, perfect. That's great. That's wonderful. Yeah.
There's certain income I made I didn't think that would actually have counted, but my high school job is on there.
Mm-hmm. Yes, that's good. Very good.
Question. Can you hear me?
Yes, I can hear you.
Okay, because by the time I tap it in chat, you guys may be gone. That's how slow I type. But let me see here. Now, the question is the statement of the yearly earning record. Okay.
Mm-hmm.
if there is a year that was not recorded, okay, and I only work part-time. Now, the part-time total is about $10,000.
Mm-hmm.
There has never been a year since I started working at age 18 that I did not work. But when you stated that you will go back 35 years of the highest, 40 years or something,
Mm-hmm.
with me being 67, and if this earner was back in 1985, it looks like to me it's not worth me going back and having them to add it to my records if I'm able to even do that.
Right. If you have your W-2 or your tax return from going back that far, definitely you can try. But like you said, if it's a lower year, it's probably not going to be counted. And that's why you definitely want to check your statements and see that you have, 35 years or so of work, which it seems like you do. You've been working forever since you're 18. So you would want to go and check and make sure that you have some higher years than, of course, $10,000. With your work history. And so it's not going to be counted anyway. It'll probably just be a low year anyway. So yeah.
Okay.
Yeah, that's a great question. Yeah, that's what you want to do. You want to be proactive. You want to make sure, that $10,000 could be a lot to somebody who hasn't worked that much. So they might need to do that. But in your situation, if you have a healthy work history, it might not be worth it for you because it could be just a low year. So yeah. You're welcome.
Let's see in the chat. Let's see how we can review this again. So I forgot to mention, we will actually be, I can email everybody the file for this PowerPoint presentation. I have everybody's emails from the registration, so I will be able to send this out to you. And then the actual presentation is going to be uploaded to the YouTube channel. I can actually include a link to that as well, and that way you'll have access to that. I don't have an exact time frame for when it'll be uploaded. I'll also try to make sure to put up that information as well. For part 2, let me see that I can include. That's gonna be
You
through.
can include that with the follow-up email. You could include that a link, I guess, with the follow-up email with this stuff. So yeah.
Yeah, that information I can include. It's on the same website as the sign up for part 1 was. We have an event calendar on the Newport News website. And then I'll go ahead and include that in the follow-up email as well. I'll go ahead and send that as soon as we're all done here.
And you said maybe your Facebook page at some point you'll have it there too.
Yes, so any program that Newport News does, we always make sure to mention it on the Facebook page.
Perfect.
Okay, I have one more question.
Okay, good.
Okay, I could probably ask my tax lady, but being that you're right here in front of me, let me just ask you why the thought is in my head.
Okay.
Last year, when I turned 66, was when I started drawing my husband's Social Security benefit. Okay. And at first, I didn't know it was considered added income. But you mentioned a form, I think, that was 1099.
Well, you have to file taxes. Yeah, you got to file taxes on Social Security. It's a federal taxes. You're not paying state taxes. And if you want to just take out a percentage every year or every month from the Social Security that you are receiving, you can do voluntary tax withholding. That form, you can actually find it online. It's a W-4V. So you would scroll to socialsecurity.gov/forms and or just go to socialsecurity.gov, scroll all the way to the bottom of our homepage. You'll see an icon for forms. And if you type in IRS under search or W-4V, you'll actually find the form. And you can actually take out 7 7, 10, 12, or 22%, whatever you choose. You don't have to take anything out because you know you will get your tax return, you'll get your 1099 the following year, so you could do your taxes. But you're only paying federal taxes, and you could start it, stop it, change it, you know, the monthly amount anytime. So the monthly rate, if you choose to do it. So yeah. And then when you start yours, I guess you'll see if you want to definitely take out taxes too, because, you know, you'll get the higher of the two. So either it'll be his or yours. If yours is more, you're going to get the higher of the two.
Okay. I see a question here in the chat. It's asking, are there specific provisions for refugees and immigrants with disability?
No, actually, yeah. I mean, when you're applying for supplemental security income, because if you're a refugee or an asylee, you probably, if you came here as a refugee, you probably haven't worked and paid into Social Security. If you came here and you eventually started working, you're an immigrant, but you eventually started working and paying into Social Security, you can get regular Social Security disability or retirement because you worked, you got a Social Security number, you started working, and you started receiving benefits, right? Whether it's disability or retirement, as long as you worked and you have a Social Security number. If you haven't really worked and put into Social Security as a refugee or an asylee because you just came here, you can apply for Supplemental Security Income. Now, that's a needs-based program. Refugees usually leave everything in their home country, so they come here with nothing. And then if they have a disability or if they're 65 years old and you show that you're a refugee or an asylee, you can continue to get those supplemental security income benefits for 7 years. After 7 years, though, you do have to show proof of citizenship. So you do have to do something in those 7 years. You got to apply. And at some point, you have to be a citizen. Once you become a citizen, you can continue to receive the supplemental security income benefit if you're disabled or if you're past the age of 65. However, if you haven't really worked and put into Social Security, you're not going to receive that benefit. But eventually, if you have worked, you've changed your status, you know, you became a green card holder or you have a work authorization card, you know, or your visa changed, or you even became a citizen later, and you have a Social Security number, you worked and put into it, then you can absolutely apply because you put into that insurance, right? Your employer took out for it. So yeah. So with disability, I would say supplemental security income would be the way to go, because if you're a refugee or an asylee, you don't have anything. So that's needs-based, right? But you'll only get it for 7 years. And after your 7th year, they'll check to see if you're a citizen. If so, you can continue. If not, then it would cease. Okay, so from Ann, and my husband and I are both in our 70s, but why is our Social Security taxable? Well, that's a Congress question. But Social Security, they have to tax it it's a federal benefit. I know a lot of people campaign that they're gonna remove it, but again, I'm just the messenger with that. But Social Security is taxable and you do pay federal taxes. Now, again, with the IRS, it depends on how much your adjusted gross income is, what your total income is. Some people are on Social Security, but they're not paying taxes because their income is very low. So again, that's more of an IRS thing as well. But if you don't want to be taxed on Social Security with the federal government, and if you're having to pay taxes based on your adjusted gross income, then you're going to have to, that's more of a Congress change. That's more of a law change you need to do. But that's more of an IRS depending on whatever your total adjusted gross income is. So if you work and earn money in your 70s, yes. So if you are continuing to work and you're paying into Social Security, what happens is you're still working, right? Your employer is still taking out for Social Security. And if that's the case, then they will recomp your benefit. So if you're making, let's say, 60,000 and we've counted a year where you've only made 5,000, that 60,000 can replace that 5,000. right? Or a 0 year. So if you're still working, it could replace a 0 year, it could replace a low year. And that way your average will go up. So if your average, again, we're looking at the highest 35 years of the last 40 years plus inflation. So if your average does go up, you will receive a letter in the mail because we've done the recomp. You will receive a letter in the mail letting you know, hey, your average went up. We owe you some money. So you might get a few dollars because of that average. And then your family can also get more too, but depending on if you have family receiving benefits. So your primary insurance or your full retirement age amount will go up, which will help increase any benefits. But yes, if you're still working and paying into it, we do recomp it. It's automatic. Your employer is responsible because that's why they have your social security number. They're responsible for providing us that information, and it would be done automatically. But more for taxes, you'd have to contact IRS, or if you're trying to eliminate it altogether, you'd have to talk to your congressperson. I'm just the messenger. These are great questions, very different. So I appreciate these. Any other questions?
All right, that looks like it might be it. So thank you everybody for joining us tonight. Thank you, Lizna, for the presentation.
Oh, no problem.
And you'll oh, let's see. Oh, another question. See,
Oh, cool.
I am 63. When should I apply for Social Security?
Well, it depends on when you want it. But if you're trying to get it right away or in the next few months, you can go ahead and apply. You can contact the local office, or you could go to our website. You will find the links on the site, on the thing today on your email, but it's going to be ssa.gov/retirement, and you can actually apply for benefits. You can do it up to 3 to 4 months in advance. You don't have to do it 3 to 4 months in advance. You could even do it a couple of months in advance. Just depends on when you want to start it. Again, you can do it up to 4 months in advance to file your claim. You can call the local office and make an appointment for that too, on the phone. Or you could go to our website, ssa.gov/retirement, and you'll be able to do that. And you could do it 4 months in advance. You don't have to. You could even do it, like I said, the month before, or 2 or 3 months in advance. So that's fine. Whenever you're ready to retire, you can do it online. Like I said, 3 to 4 months in advance is fine, or you could call the local office. So yeah. 3 to 4 months, whenever you want to take it. You could take it as early as 62, which you're now 63, or you could even take it past 66, right? Because like I said, it continues to go up until 70. So you have a wide range on when you can take it. You're welcome.
All right. Well, oh, can the Social Security number get automatically updated once you become a citizen?
It's not automatic. No, you have to go through the office. Immigration will not update it for you, unfortunately. You do need to go through the Social Security office. You have to you would submit your certificate of naturalization or your passport. So whenever you become a citizen, if you have that, call the local office. They might make you an in-office appointment, because mailing something like that might be something that they might, you might not be able to do that. Or you might mail it, but certify mail it. So if you want to update your citizenship or anything with immigration, a document like that, with like maybe you're a refugee and you got your green card, or something like that, I would call the local office. Again, the locator link is, let me type those links, SSA which you will receive. Like I said, you're going to get all of this in your follow-up email, but you can contact the local office, and you can put in your zip code, and it'll give you the phone number. I'm also gonna go ahead and put in the My Social Security account link. So you have that as well. My Social Security. Yeah, so definitely go ahead and create your account if you need to. But like I said, if you want to update your address, update your citizenship or something like that, you cannot just get a replacement card online. So doing any internal update like that, you will have to provide proofs. You do have to mail in originals. So again, I would call the office and see if they could actually make you an in-office appointment for something like that, or if you'd have to mail it in certified. If you cannot create an account, usually if you have a driver's license or a state ID, you'll be able to create your account. But if you're not able to, you can contact the local office. Again, our office hours are Monday to Friday, 9 to 4. We'll answer any and all questions. If we can look you up and see what's going on and why you can't create an account, maybe there's a discrepancy with your birth date, your name, city and state you were born, or country you were born, whatever the case may be, we can look it up for you. You just have to identify yourself with the local office, and a rep will be able to help you find out what the reason is. But you could definitely try. In fact, with the follow-up links you're going to get, I think we do have a flyer on how to create your account. So you could definitely look into doing that. But if you cannot, you can call the local office, and we do have reps that will be able to assist. You're welcome.
Any last minute questions? And if you don't have one now, and we'll have another question and answer session after the the presentation next week.
These are great questions.
All right. Well, thank you everyone again for coming tonight, and I'll go ahead and get to work on that email for you all.
All right. Thank you so much for having us. See you in next week.
See you next week. Have a good night.
You too.